welcome to Medical Dialogues. I'm Roshni Dhal. Let's look at today's top headlines. Demand for NEET-PG postponement reverberates in Parliament. While responding to the request of students across the country for postponing the NEET-PG examination 2023, the Union Health Minister Mansukh Mandaviya informed the Lok Sabha that since the exam date was announced around 5 months ago, the students should not face any problem to prepare for the exam. Further, the Health Minister pointed out that in order to ensure that none of the students across India suffers due to eligibility criteria, the government has extended the cut-off date for completing MBBS internship till 11th of August. More than 250 government doctors under UP Health Department scanner. More than 250 doctors from Uttar Pradesh have now come under the radar of the State Health Department for not rejoining their duties after taking a sabbatical for finishing a specialization course. Already taking cognizance of the issue, the Health Department has prepared a list of such doctors and soon notices will be issued to them in this regard. In case those doctors fail to submit explanation for their unauthorized absence or resume their duties, they will face disciplinary action. Long-term air pollution exposure raises depression risk according to studies. Long-term exposure to air pollution raises the risk of depression according to a pair of new studies published in the JAMA network of scientific journals. A study published in JAMA Network Open found that long-term exposure to elevated levels of air pollution increases the risk of late-onset depression among the elderly. The other study published in JAMA Psychiatry found that long-term exposure to even low levels of air pollutants was associated with increased incidence of depression and anxiety. Air pollution has long been linked to cardiovascular and respiratory diseases. The new studies add to a growing body of evidence that air pollution also affects mental health. For the study of the effects of air pollution on elderly Americans, researchers from Harvard and Emory University examined the data of nearly 9 million people on Medicare, the US government health insurance scheme for those aged over 64. More than 1.52 million of them were diagnosed with depression during the study period of 2005 to 2016, according to Medicare claims. Can eating 1 to 3 eggs per week help protect the heart? The humble egg is a powerhouse of nutrition, offering large doses of protein and B-complex vitamins. Plus, it has a very few calories and can be cooked in a multitude of ways. A single egg provides 186 milligrams of cholesterol, which is more than a half of the maximum recommended daily intake for healthy people. This brings up the question, how many eggs can you safely eat each day? A recent study published in Nutrients explored how egg consumption affects one's heart health, and the paper's authors reported a striking finding. The study suggests eating 1 to 3 eggs a week is associated with a 60% lower risk of developing cardiovascular disease. In fact, the study found an even lower risk of developing cardiovascular disease, 75% for those eating 4 to 7 eggs a week. However, they only found a protective role in eating 1 to 3 eggs a week after considering socio-demographic, lifestyle, and clinical factors. The authors concluded that egg consumption may have a protective role against cardiovascular disease when included in healthy diet with low consumption of saturated fatty acids. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.